Hello everyone, I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member, and in this segment I'm going to be going over National Mental Health Awareness Month in 2024. Now, every year the month of May is designated as National Mental Health Awareness. This year what I decided to do is read out President Biden's proclamation on this important month. So he starts off by saying, during National Mental Health Awareness Month, we recognize the bravery and resilience of the tens of millions of Americans living with mental health conditions, and we show our gratitude for the dedicated mental health professionals and devoted loved ones who stand by them every step of the way. So let me read some of the highlights here that are important. So he starts off by giving some important statistics on mental health and mental health care. He says that millions of Americans' mental health care is out of reach, and I actually previously have provided some important facts about this matter through geospatial. He goes on to say in 2020, less than half of all adults with a mental illness diagnosis received care for it. And that's alarming because mental health care is of paramount importance. In fact, it becomes worse for kids. There are 70% of children who need mental health care and can't get it. And he goes into a scenario, and then anxiety. 2 in 5 adults report experiencing anxiety or depression, and suicide that is the leading cause of death among young people. So he has already gone over what the problem statement, what we would call in research problem statement. So what has he done? Well, he signed the Bipartisan Safer Communities Act, investing $1 billion, the largest investment in youth mental health care ever. And so this $1 billion will go towards hiring and training new mental health counselors. There's more than 140 certified community behavioral health clinics around the nation, serving anyone regardless of their ability to pay. They also talked about a hotline known as 988. That's the Nationwide Suicide and Crisis Lifeline. Here, anyone can call, text, or chat to be connected to a trained crisis counselor. He also talks about expanded Medicare coverage to include additional substance use disorder services and expand mental health services. Then he talks about health insurance, taking action to ensure that state and local government employees have the same mental health parity protections as millions of Americans. He talked about the opioid epidemic and cracking down on fentanyl trafficking and increasing public health efforts to save lives. And then he talks about continuing to call on Congress to restrict the personal data that companies collect, ban advertising that targets minors, and take action to ensure that social media platforms prioritize the health and safety of the nation's children. He talks about, again, he mentions 988 to reach the National Suicide and Crisis Lifeline. That means that he was really promoting this. Also, if you are a new or expecting mother, you can call 1-833-TLC-MAMA, otherwise known as TLC Mama, for confidential advice on mental health from a professional. So another number that he talks about is SAMHSA. Through SAMHSA, for people that are feeling overwhelmed or just need to talk with someone. And that is 1-800-662-HELP, HELP. He ends with talking about calling upon citizens, government agencies, private businesses, nonprofit organizations, and other groups to join in activities and take action to strengthen the mental health of the nation and communities. With this, he actually ended his proclamation and talked about some of the areas that still need work. I hope this has made some sense. Thank you for listening.